My name's Michael Reese. I grew up in Kettering, Ohio, which is a suburb of Dayton. Went to Ohio State University, got an undergrad degree in microbiology, veterinary school at University of Florida. And after veterinary school, I bounced around. So I did a rotating internship at Tufts, neuro-specific internship at Gulf Coast in Houston, Texas, and then my residency training at Purdue. After Purdue, I stayed on as assistant faculty for a year and then migrated to Florida, back to where it's warm and there's no shoveling of the driveway. So I was drawn to neurology because it's a mixture of medicine, surgery, and diagnostic imaging. I really enjoy diagnostic imaging, and then I was kind of torn between medicine and surgery, and this is kind of the best of all the worlds together. So one of my most humbling cases is a dog named Bear. He was a 7-year-old Wheaten Terrier that I saw with Dr. Adams. He presented basically laterally recumbent, non-responsive. We did an MRI with minimal anesthesia and found a large brain tumor that was obstructing his spinal fluid. So had a lengthy discussion with the owner on expectations, and the owner wanted to give him every chance despite the prognosis not being in his favor. So we ended up placing temporary shunts in his brain to divert the spinal fluid, and within a couple days he was up and walking and went home. So really it was amazing how quickly he recovered. And then Dad did radiation therapy, and he ended up living 3 years when I thought he was going to live months. So it's humbling to see a case that debilitated and have that kind of negative attitude, and then just a blessing to see how well they can recover. So the easy way to answer that question is really just seeing cases that look terrible and how well they can recover given the chance. The hard part with what we do, and the honest part of the opposite side, is we don't win on all the cases that we see. So it's great to see the ones that do. It's the ones that don't get better that really stick with me the most. So the saying goes, you learn more from your failures than your successes, and statistics mean nothing to the individual. So even though we see these cases and they have 90% chances of recovery, it doesn't mean anything for the one that doesn't and is in that 10%. So it's great to see them recover, but I learn more from the ones that don't, because it makes you forced to take a step back and have some introspection on what you can do better as a doctor. And I think that's the most humbling part of what we do. When patients are neurologic, there's definitely lots of questions, and questions then put into the mind, more questions, and then it can get to fear of the unknown. I think the biggest part of what we need to do here is communicate, because we need to make sure everybody that comes here knows what's going on, what they're up against, and what we can do. My wife has drilled into me communication is key, and she's right. Everything we do needs to be communicated clearly. The people that come here are worried about their furry kiddo, and they need to know what's going on, and that's where communication is key, to make sure they're comfortable with what's going on and with what needs to be done, at least to the best of our ability. So my wife and I, when we got together, we had a blended family. So she had 2 dogs and 3 cats, and I had a dog and 3 cats. So we put together a lot of animals under one roof, and we've gone through attrition over the last 9 years. So I've just lost my 22-year-old kitty and my 18-year-old kitty. So it was great to have such a long time with them, but at this point we're down to the end of our original group. So we have a 17-year-old kitty that has some health issues now that we're dealing through. But really, I just went up to Ohio and retired 3 barn cats to Florida from my dad's property. So they are loving South Florida. They're enjoying chasing lizards, and I think overall they've gone from feral cats to pretty darn sociable in a matter of months and years.